Namaskaram. Wishing each and one of you a blessed and rejuvenating Dhanwantari Jayanti. Let's begin this webinar with gratitude and devotion, remembering that every healing touch and every act of care carries the divine light of Dhanwantari himself. So, today we are going to discuss on the topic Pediatric Care in Ayurveda. Myself, Dr. Tara Jayashree, presenting here. So in Ayurveda, Kaumara Bhrityam or Balaroga Vijnanam comes under pediatric. It is the science which works around the disease of the children and their treatment. So it focuses more on the importance of physical and mental and psychological growth of every child. So the Kaumara Bhrityam and this pediatrics starts from the prenatal care. So as we all know, there are different medications for the prenatal, and from the time of the conception, there are plenty of spectrum of the medications given to the carrying mother for the health of the mother and the child in the womb as well. Since the mind of the fetus starts begin expressing in the 5th month of the pregnancy and the intellect in the 6th month, a pregnant mother should always adhere to a sattvic diet. From the 6th month onwards, the diet should be including too much of nootropic herbs like Brahmi, Mandukaparni, Shankapushpi, etc. So an Ayurvedic diet for the kid should always be a balanced, focused on natural, light, heating, and fibrous foods like fresh fruits, vegetables, legumes, whole grains, inclusive of digestive spices such as garlic, ginger, cardamom, turmeric, everything, so that it kindles the easy digestion. So usually many patients ask what is the best oil for the massage for the children. The oil should be in such way which calms the nervous system, lubricates and rejuvenates the tissue, and improves the circulation. So in Ayurveda, some common oil used are Balashwagandhadi Tailam, Lakshadi Tailam, Bala Tailam, based on the constitution of the child. So there are samskaras or the rituals done in every child's life. So what is the importance of sanskaras? It plays a prime role in child's health system and overall development of the child in every step of the life. It also prevents the disease and also adapts the environment for the further survival, and it educates the child and it helps a platform to know about the our ancestral rituals also. So the first and foremost is Jatakarma Samskara, which has to be performed immediately after birth. So giving a drop of Gritha and Madhu, which is expected to be acting as Medhya, Ayushkara and Pushtikara for the child. Ghee and honey in equal quantity may stimulate the immune system of the child immediately after the birth. So it has to be given in an unequal quantity. So a mixture of both the thing immediately linked to the born child can improve the immune system. Next comes Namakarna Samskara. So develop a parental bonding with the baby and understanding of parental responsibilities. So bathing of the mother and the baby with medicated water also ensures hygiene and disinfections. Third comes Nishkramana Samskara. So that is like taking the child. In the ceremony, the baby is taken out of the Kumaragara or the home first time. So what does it does to the baby? It empowers the baby to adapt to the external environment. Preferably, they are taken to the temple to hear the Shankanada or chanting of the Vedic mantras. Next samskara is Annaprashna Samskara, where we feed the baby with rice after they slightly wean off or even they are with the breast milk. And the main purpose is to improve the vitamin C to develop the immune system. Next is the Karnaveda Samskara, where there is a local inflammation which occurs after Karnavedana created by the wound, which may act as a buffering mechanism for the stimulation of the body's immune system. Next comes the Chudakarma Samskara, where we can examine the skull and stimulate the hair growth. And we can equally detect the abnormalities like wide sutures, microcephaly, macrocephaly, elevated or depressed fontanella, etc. Then comes Vedaramba Samskara, that is Vidyarambam, where we make the child to write with turmeric and rice, Harishri Ganapati Namaha, with a piece of either gold can also be used in the tongue of the child. Next comes the Upanayana Samskara, which signifies the spiritual rebirth. That's why after the Upanayana Samskara is performed, the young becomes a Dvija, that is the twice born. The brain growth of the child gets completed by the age of the 5. A thread tied around the waist may serve the purpose to access the physical growth and to rule out the malnutrition also. So next comes the Lehana and Swarna Prashna Samskara. During the Shira and Nada stage, development of the brain occurs at the very faster rate so that the Medhya Rasayana is used to strengthen the nervous system of the child. So usually in infancy, nurturing the seedling is very important. So we need to focus more on the skin radiance, immunity. Abhyangam can be done. Body temperature has to be regulated. And the nourishing scalp and the body is very important. And lot of digestive issues like colic, constipation, gases is very common among the children, which has to be ruled out. Also, there may be respiratory issues where we can give honey and ginger daily, tulasi arka, karpuravalli arka, swarna prashnam in every pushya nakshatra, which can help to improve the immunity. So, in the middle age, it is just like nurturing the young tree. So, their eating habits should be properly noted. Sleep issues should be focused. Behavioral pattern, especially adolescents, ADHD, autism, and social issues. So combating adolescence, so lot of behavioral changes, especially with the teenagers and hormonal issues during the puberty also. So offering more focus to the immunity, we can give Chavanaprasham, which is a nutrient-rich jam made with amla and also supportive ingredients. It helps to improve the physiology of the child while blustering into the immunity system also. Then you can even give spiced honey with black pepper, cinnamon, cardamom, ginger, turmeric or tricottu, which helps to improve the digestion and supports Agni and clears the excess or Vikruta dosha. Then comes any common ear infection where we can use garlic ear drops, hot and cold pad. Their sleeping posture has to be corrected. Mustard oil for the wax. Olive oil can be used. And fried kulata, that is the horse gram processed with honey, can also be used for as a ear drop for the ear infections. Nowadays, common problem is childhood obesity. So we can use some single herbs like shunti, vidanga, vacha to reduce the agni. And also you can give high fiber foods like tomato, green leafy vegetables, honey and lemon juice daily. Mint also helps in improving the digestion and also helps in the weight loss. Then dietary adjustments. Just try to give balanced meal and focus on warm food. Limit down the sugar and processed food. Try to supplement the herbs right from the beginning. Encourage them to do regular exercise. Encourage them for the adequate sleep. Limit the screen timing. And always focus more on periodical detox. So, for numerous skin conditions like eczema, mosquito bites, durva, that is the Bermuda grass, can be used. Harita manjari, that is called kupaimeni, that paste can be used. And paranti, that is techi, can be used. Nimba leaf paste can be used. And haridra. Oatmeal can also be used in several skin conditions. Mehendi leaves is very good for the psoriatic and fungal skin lesions. Then Shankapushpi for scabies and saffron, kunkuma can be used for acne, skin eruptions and all. Oatmeal lotions can be used for rashes, burns. Cabbage leaves paste can be used for the psoriatic lesions. Coming to seasonal flu, to avoid that, we can give karpuravalli juice, shallots, beetle leaf, and palm candy. You can give them frequent tulsi leaf juice, ginger juice, harad, amla, ginger, pepper combinations. For gastrointestinal system, you can always give them combination of cumin, dry ginger, banana with honey, cardamom water, coconut water with kernels, draksha with jaggery, include carrot juice, butter and sugar to improve the acidity, gas bloatedness and all. So to improve that digestion, the above can be used. And for some irritable bowel syndrome, you can give mango seed powder soaked in salt water, and it can be given internally. And the skin of dadima can be used as either concoction or powder. Arrowroot powder can be used, and bilwa fruit can also be used. Sometimes they end up with anal bleeding due to the excess heat. There we can give Jiraka churnam. In case of constipation, the kalka of Mayaphala, that is the masikai, can be used. And the root of cucumber climber can be used to relieve the urinary infections also. And inflammation of umbilical cord, there we can use the tip of durva leaves fried in ghee. So sometimes they complain of vomiting of the breast milk, where the jiraka kalka can be applied over the nipple of the mother and made the child to consume that. And sometimes excessive salivation and mouth ulcers, where the swarasa obtained from incising the top portion of the small immature coconut fruit. It's a very good medicines for mouth ulcer. Constipation, where we can give sesame seeds, poppy and flax, little bit of castor oil, warm milk with ghee, soaked raisins, and hing application in their stomach or umbilicus, yogurt with flaxseed powder, amla juice, oat bran, and of course, hydration has to be done. Sometimes they struggle to sleep, so you can oil their scalp. You can give some ashwagandha extract, almond seeds, hibiscus tea, jatamamsi, and lessen them their screen timing. So sometimes they also have corneal opacity. They use specs in a very younger age, where we can give Trifla churnam, and you can make some collyrium with kalka of honey and breast milk also. So these are some foods which can prevent the eye issues like carrot, red peppers, broccoli, strawberries, sweet potatoes, spinach, citric fruits, almonds, fennel seeds, soaked almonds, raisins, amla, desi ghee, and encourage them to do some eye exercise. So some of the media herbs like Brahmi, Mandukaparni, Ashwagandha, Vacha, Shankapushpi can be given on a periodical basis, or some media gritams like Brahmi Gritam, Saraswata Gritam can be given on a daily basis. So Mahakalyana Gritam, Panchagavya Gritam, Brahma Rasayanam, Ashwagandha Rishta, Saraswata Rishtam can also be given on a daily basis. So some Rasayana herbs like Tulasi, Ashtimadu, Shatavari, Amlaki, Bringaraja can be used. So iron deficiency anemia, especially when they attain puberty or teenagers, they enter into the anemic stage, where we can include apple juice, beetroot juice, sesame seeds with honey. Like you can include spinach, parsley, dates, tomato, moringa leaf, and ghee in the morning. Fenugreek seeds and leaves, methi roti, and almonds soaked overnight, and juice of amla can improve really their hemoglobin level. Osteohealth. So those who are more into the field work or the sports and all, their bone health is equally important, where you can give Arjuna extract, Asti Shringala, that is Pirandai, which you can inculcate in your food habit also. Haridra, Moringa juice, Tila, Nimba, Krishna Jiraka, Dadima, Shunti, Ashwagandha. These are some single herbs which can help to improve the bone health also. Hair fall and lice is again a common problem with the teenagers, where you can use onion juice for the before the head bath, sitafal seed paste, garlic cloves, and some essential oils. So jaundice, again, during the early symptoms of jaundice, you can give them radish leaves with boiled water, and you can make them to drink sugar cane juice, neem leaves and jaggery, amla, tulsi leaf, ginger, and a paste of few papaya leaves added with honey, which can equally reduce their fever symptoms also. Barley water, amla, goat's milk, tulsi leaves, aloe vera juice, and juice of bitter gourd, and roasted cumin with buttermilk can improve their appetite also. So the stem juice of guduchi and sugar cane, trifala, roasted chickpea also improves the appetite. And lemon juice with sharkara can help to improve their rejuvenation. So in cases of asthma, you can give boiled amla, raisins and ginger powder, decoction of black pepper, shunti, and tulsi leaves, paste of raisins, dates, long pepper, yashti and all. And yashti with ginger, vamshalochana, that is the bamboo seeds, pipali churna with honey. Then for the skin marks after the chicken pox, you can apply paste of Rakta Chandana, Haridra, HT, and even Shatadauta Gritam can be applied. So this is bedwetting is again a common symptom in many children. So there are some simple and home remedies like chewing on cinnamon bark and a spoonful of jaggery with warm milk at the bedtime. And amla powder with little black pepper, you can give it with warm water. Nutmeg powder can also help them to reduce the intensity of the bedwetting. And walnut with raisins and sugar with banana and amla juice can also help to reduce the bedwetting. And coriander seeds, sesame seed, babul, pomegranate flowers with sugar mixture can help to reduce the bedwetting. And cranberry juice, fennel seeds brewed into tea can help to reduce the bedwetting. And also deworming, it is it is a very important karma for all the children because of the excess sweet and sugar intake. So crushing the papaya seed with warm milk given on empty stomach can help to reduce the worms. Grated coconut every day helps to reduce the worms. And pumpkin seeds with honey and buttermilk with turmeric can also reduce the worm infestation. Pomegranate bark juice and even the fresh juice of pomegranate can help to reduce the worms. Carom seeds, ajwain seeds with neem leaf and hing with either a glass of water or buttermilk. Nutmeg powder with honey reduces the worm infestation. So these therapies are used in the initial stages and it is not any medications or anything. Like when you just start noticing the seasonal flu or when you can find the initial symptoms in your children, these are some simple home remedies. And when it exceeds to certain limit, you may have to consult a proper physician when you just go for the classical formation. Thank you.